Ashwini. I have to start the recording. I just missed it. Okay. Okay, so where were we? Yesterday we had some slides pending. So let us finish those slides of pelvic floor. Okay. So this is what? Okay, this is of the hip. Okay. So not this one. We have share screen and what is it? We have the pelvic floor. Okay. Okay, here it is. We were, okay, we'll just have a quick recap of faster. Yeah. You can see it perfect. Let me take it a little more shorter. Namaste, Mona. Okay, and here I have more hide video panel and hide floating weighting controls. And here we are with the pelvic. Okay, so we'll have a fast, quick recap and come to the point. So we talked about the pelvic floor muscles. I told you what are those: bladder, uterus, bowel. These are basically connection to the pelvic floor muscle. That means anything problem with the pelvic floor can have a problem with the bladder, uterus, bowel. Okay, and even your sexual dysfunction: bladder, uterus, and vagina, prostate for men, the rectum. Okay, talked about weak glutes and leg. We went through all these things. Okay, so glute plays a very important role. So see that you don't neglect the glute muscle. Okay, those are hip extensor, but apart from that, their connection is more deeper. We went through these athletes are experience incontinence. Why? Because they cannot hold because of jumping, because of the way they are in the sports. Yeah. So we need to be aware that those who are into sports, they need to work on pelvic floor muscles by strengthening them. Why? Because by running, jogging, they actually loosen it. Okay. Childbirth, mother prolapse uterus, this is where control feces. We went through all these, supports abdominal and pelvic content. Breathing definitely helps in breathing, stabilize the spine and pelvic. Role in sexual, so this is what it is. Then we go with anatomy, male and female. Pelvic diaphragm, we went through it, coccygeus and the levator ani. Okay, we don't need to remember all these things. This is not required. Okay. Yeah, coccygeus, iliococcygeus, and pubococcygeus. These are the three things that we require to know. Anatomy, some of these names are taken. That's the reason. Levator ani. Okay. Puborectalis, pubococcygeus, and iliococcygeus. So when the word levator ani comes, there's a group of muscle: puborectalis, pubococcygeus, and iliococcygeus. Now here is the connection: your pubic symphysis and the sacrum, the red dots. Okay, and there the muscle starts. Okay, this is with puborectalis. It's a U shape. Then we have pubococcygeus, PC muscle, also known as in some anatomy books, the word is written as PC muscles. Okay, just keep that in mind. PC muscles, pubococcygeal. And the other is iliococcygeal. In together, this is known as a levator ani muscle. Okay, so these three in group. The only thing I want to remember is PC muscles, because some of the anatomists, instead of writing the pubococcygeus muscle, they will say just PC muscles. And then we are saying, oh, what is PC muscles? Okay, so that's the reason it's very important to know that the PC muscles are the group in the levator ani. Okay. Pelvic floor stability, we went through all these things: opening and closing of pelvic floor splinters. Okay, we talked about here, it can be tight, it can be weak, depends. Difficulty in urination, pain in the groin, sensitivity of genitals, pain with bladder feeling empty, difficulty with passing stools, leaking. Okay, weak, urinary fecal incontinence, accident, loss of fecal or wind, a vaginal, rectal, or uterus prolapse. Okay, uterus prolapse is, it's very common. You'll find uterus patients with uterus prolapse, uterus actually prolapse uterus. Okay, erectile dysfunction. So remember, as yoga teachers, we first need to understand if someone is coming with any of these pelvic floor issues. You need to know, is it tight? Is it weak? If it is tight, what needs to be done? If it is weak, what needs to be done? This first thing you need to understand. And if, when you realize that this is what it is, and in fact, I will say, recommend, don't wait for the problem to arise. Start adding your breathing practices. Namaste, Chari. Yeah. Start adding your breathing practices with the core. You know, simple. Pelvic tilt, pelvic thrust. Pelvic tilt, pelvic thrust exercises. Pavan Muktasan, Setu Bandhasan, Viprita Karani. All these, my friends, add the pelvic floor movements, the Ashwini Mudra. Yeah. the Ashwini Mudra. Very important practice. Make it a point that don't wait. Someone says, I have a pelvic floor issue, and then you do it. Just in your normal practices, have you added a sequence? Even you simple as Purna Pavan Muktasan, hugging both the knees to the chest, have you added pelvic floor engagement, pelvic floor movements? Okay. And in pelvic floor, we don't need only tightness like Kegel. We need Ashwini, where it goes, front and back movement. Okay. We went with high risk, who are high, okay, surgery. Fitness enthusiasts and athletes are nowadays very common because of the jumps and stuff like that. There it is very common. High intensity interval training, high load, gymnasts, boot camp runners. Risk increases if one is a heavy weightlifter, push and strain. If someone is constipated, in constipation also it happens because people put a lot of pressure on the pelvic floor muscle, right? Chronic cough or sneeze, overweight, forceps birth, difficulty, delivery, pelvic radiopathy, right? And back pain as well. So back pain can also increase your pelvic floor problems because your pelvic is into a anterior tilt. Yeah. Pelvic floor habits, tight or weak, loose and weak, sitting, biking or spinning. Okay. So these are some things that we should realize. Okay. Is it a person is stressed? In stress, it will be mostly tight. Okay. In stress, it's mostly tight. And that's the reason breathing practices, belly breathing would always help in that case. Okay. PPT, tight glutes, holding tension in pelvic floor, not walking much, not using our hips much, lots of Kegels. People do a lot of Kegel. That's the reason. Anytime they are just doing Kegel all the time, they are only contracting. They are not relaxing it. That's the worst scenario. Jogging, aging, pelvic surgery. These are all because of if it is loose and weak, jumping around trampoline, CrossFit, pregnancy and childbirth, APT, weak glutes, anterior pelvic tilt, constant belly breathing. Yeah, there are many people who are doing constant belly breathing. That can be also a problem. Being overweight, sexual abuse, laughing, weightlifting with belt. Okay. In fact, in Kapalabhati also, as I told you, whenever you do Kapalabhati, slightly engage the pelvic floor muscles. So the pelvic is stable. Yeah. As I told you, and you did that practice also. Okay. Coughing, evacuation pressure. Like sometimes, you have to really put a lot of pressure while you're evacuating. Sneezing, or even hereditary also. Yeah. Hereditary. So remember that if these are some of the things that can either make it tight and weak or loose and weak. In both the cases, it is weak. Okay, it cannot be tight and strong. Okay, tight and weak, loose and weak. Okay, Kapalabhati Bhastrika. It's a lot of abdominal pressure where the lower base pelvic floor is not being contracted every time the pressure is coming downwards. Yeah, that is also one of the worst cases. And Kapalabhati and Bhastrika can also increase your back pain. Yeah, just keep that thing in how cuff can increase. Okay, pelvic floor muscle is a part of the core. Okay, when we say core muscle, the diaphragm, the multifidi, the transverse abdominis, the deepest layer, and the pelvic floor, these are your core muscle. Okay, these are core base of the core group muscle, right? So that's the reason it's very important to understand that the pelvic floor, your diaphragm, whenever say core group of muscle, in core group of muscle, you should know that the multifidi, TVA, transverse abdominis, diaphragm, and pelvic floor. These are 4 of your very core muscles of your abdominal region. Okay. Pelvic floor exercises, Kegels. Okay. Then it's our Indian way of Moola Bandh and Ashwini Mudra. These are very standard practices in yoga. Okay. And the Kegel is one thing that everyone asks to do it, but there is always a pros and cons. Okay. Let's try to do that. Kegels helps in short term. Okay. It's a short term work. If tight, PF Kegel does not work. See what is happening, pelvic floor Kegel. If it is your pelvic floor is already tight. Okay. And on the top of that, you're doing Kegel, contracting it more. Actually, you're creating more nuisance to the pelvic floor muscles, right? We need to do something that can also relax the pelvic floor muscles. What people used to do, they learned about pelvic floor. Every time they started doing the Kegel, every time, anywhere they could. Got it? That is not, and a stage came that when the people were passing urine, they started stopping their urine and doing it. Got it? See, the method to let you know that when you're passing that urine and you're holding it, it is just to make you aware where is your pelvic floor muscles. Okay, your PC muscles. but it was not meant to be a part of your regular exercise. Got it? Passing urine and doing Kegel is not right. It was only meant for you to be aware that, okay, this is what you need to do. You got it? Right? So just keep that thing in mind. Glutes and pelvic floor. Initial stage also we talked about it, that the glutes and the pelvic floor is connected. That's the reason we need toned glutes, not weak glutes. But in anterior pelvic tilt, what happens? The glutes become weaker, right? Pelvic tucking is equal to tight PF. Okay. Pelvic tucking in becomes a tight PF, tight pelvic floor muscle. Okay. What is that? Posterior pelvic tilt, right? In APT, it's becoming loose, but in PPT, posterior pelvic tilt is becoming tight because your glutes are getting tighter, right? So whole area of the pelvic floor gets squeezed. Yeah. Work on adductors, that is knee squeeze. So what you need to do is put a ball, you are in a semi-supine position, take a small ball or a block of foam and try to work on the adductors, inner thigh muscles, okay, inner thigh muscles. That will work, okay. Now let's see Dr. Arnold Kegel. This is the person, and biomechanist KT Bowen. This is Arnold and this is biomechanist. Now what happened is, Dr. Arnold started with the Kegel and everyone was like, oh, Kegel, 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 very good. But then biomechanist KT Bowen came in and say, no, you can't only contract, you need to relax. And this is where the term came that, okay, it's not only about Kegel all the time, you have to also relax it. Because when she did a research and she came to a conclusion, and that becomes widely popular. It becomes, it became popular that, okay, we don't need to only contract, we also need to release. You can always get more information on biomechanics, KT Bowen. She talks about the pelvic floor muscles. So both of them were right, but in certain situations where the pelvic floor is weak, you can add Dr. Arnold's Kegel exercise, right? But where the pelvic floor is tight, we need to do an Ashwini Mudra, where you can relax the pelvic floor muscles. Do some breathing practices. Anything that can relax the pelvic floor muscles. Yeah, got it? That can relax the pelvic floor muscles. Let's go a bit more further. Stop and release urine, as I told you, good for training purpose only. Training purpose, but don't make it a habit. Okay? Very important part, because I've seen many people doing it. Learn to relax, learn to strengthen. Both the things. Okay? Exercise and asanas, no glutes, no abdomen. Now what happens is, whenever people start working on the pelvic floor muscles, instead of actually using the pelvic floor, they will either tighten the glute, they will tighten the thighs, or they will squeeze the abdomen. These three things are bound to happen. But whenever you teach someone pelvic floor, these three things should be excluded. No glutes, no thigh contraction strongly, no abdomen. Especially that will happen when you're doing a semi-supine position, Tadagi Mudra, with the knees, feet flat on the floor. Okay, then it is worth it. Otherwise, avoid it. Okay. So contract and release quickly. This is Ashwini Mudra. In Ashwini Mudra, what we do? Contract, release, contract, release, contract, release. That is Ashwini Mudra. Okay. And I will recommend this practice, Ashwini Mudra, in our regular Purna Pavan Muktasana, or also known as Apanasana, or Setu Bandhasana, or Viprita Karani. Anything that has open pelvic, like when you're doing Pavan Muktasana, the pelvic is really open to the sides, is easier, right? So anything with that, if you're adding Ashwini Mudra, that would be an amazing practice. Okay, so add Ashwini Mudra, contract them slowly. Moola Bandh. What is Moola Bandh? You will slowly, like you're doing Kapalabhati, right? In Kapalabhati, we want to slightly contract the pelvic floor muscles and do the practice. Okay. Contract and hold. This is one more practice of Moola Bandh. Contract and hold 5 to 20 seconds. So you're contracting, you're holding a 5 second and then releasing. Then contracting, hold it for 10 seconds slowly and steadily, or increasing the time duration. Okay. Variations, you can do it in sitting, lying, standing. All the variations are fine. But remember, if someone doesn't have any problem, you can add it for that time when you're doing a yoga sequence. Remember to consciously engage during each exercise. So your awareness should be there. Otherwise, normally people don't do that. Pelvic tilts and pelvic tilt clock. Remember, pelvic tilt moving front and back and pelvic movement side to side are very important practices. Okay. Utkatasana, chair pose, squat or malasana is once again a very good practice. Setu Bandh, Supta Baddha Konasana. Okay. Supta Baddha is reclining. Split tabletop. Okay. So my leg is, I'm in a supine position, tabletop, and I take my leg out and back in, out and back in. Okay. Clamshell, lying down the sides and moving the leg open and close. The knees are opening and closing. That is known as clamshell. Okay. Bird dog or Dandamay Bharmasan. Bird dog is that English version. Dandamay Bharmasan is you are in a tabletop position. You take your right arm, left leg. You know, yeah, exactly. That is, I think we have done also, where we engage the TVA, transverse abdominis. Cat and cow spine stretches. Once again, amazing practice. Okay. And balancing, all balancing postures, my friend, will help you. Okay. Moola Bandh and Ashwini Mudra. Don't forget the Moola Bandh and Ashwini Mudra practices. Okay, don't miss out. So in a week sequence, whenever you have a Purna Pavan Muktasana, apart from breathing, add a movement of the pelvic floor as a normal practice. Every time when you're doing it, when you're doing an Apanasana, add this. Okay. Now, this is some of the instruments available to actually strengthen the pelvic floor muscles, or that will help you to know how much strength you have in your pelvic floor. So this is one that is there. It is you have to squeeze it. You can feel the pelvic floor muscle, and the others are you have to really insert, okay, inside, and then it will, when you start contracting, it will tell you what is the pressure being created, and both the things will give you basically a measurement. So these are some of the latest instrument available in the market, to work on. So this is different ways to know how your pelvic floor. Now it is good for people who actually have pelvic floor problems. They can actually see what is this and how they're improving. Like a normal person doesn't require it. But if someone is going through a hell and they really want to work on, then this is one of the best way to get a proper measurement. Okay. Now research papers. This is some of the places I've taken the information from: Yoga Mimamsa, National Library of Medicine, ResearchGate, International Journal of Research Analytic Review, okay, and Arizona State Urological Institute. Okay, so these are some of the places that you can always go there, search for research papers, whether it is Jalanethi or any of the back pain and stuff. It will get a lot of information because it's a proper research done by college. Yeah, makes sense. So I will definitely share this. You can always go there. Okay.
So even your institute in Lonavala does a lot of research, no?
Yes. Kevaledham. That is Yoga Mimamsa is only that only, yeah, Deepak. Yoga Mimamsa is actually the research papers of Kevaledham.
Okay.
You know, yeah, the Yoga Mimamsa is like when you subscribe, you will get, I think, either an online copy or you get a hard copy. You have to subscribe, and whatever researches had been done in 70s, 60s, 50s, you will all get. Namaste, John. Yeah, you will all get. So it's always good to go through research papers, my friends. You will learn a lot. You will learn a lot because over there they say these group of people were doing this thing, the other group of people is not doing nothing, and then the result came in. So it's very good. It's very good. Yeah. So that finishes with the pelvic floor muscle, and the conclusion is you need to contract, you need to relax. Got it? You need to contract, you need to relax. And always add Ashwini Mudra and Moola Bandh into your practices. Always. In fact, first of all, you should practice when you do a Pavan Muktasana. When you're doing breathing practices, add it into your practice. It's an amazing result. And I have actually seen result with prolapsed uterus, my friends. Yeah, prolapsed uterus. Amazing. But the only thing is that the result takes at least 3 to 4, like roughly 1 month to get the person to feel it better. Yeah, just a sec. Just a sec. Give me a minute, friends. I'm coming. Yeah, just a sec. I just need to receive something. Okay, thank you. Okay, sorry. I had received some courier. Okay. Okay, right. So we are clear with pelvic floor, right? Now, let us go with hip muscles. Okay. So let us go with hip muscles. Then we will take a break at 45. Yeah. Yeah. Still, it's like just 25 minutes passed by. So taking a break right now doesn't feel good. Nah? Yeah. So that's the reason. So I'm continuing with it. Okay. And I actually am not feeling to take a break right away right now. So that's the reason. Yeah. You should feel like, yeah, I actually was heavy headed and I need to take a break,
Yeah,
It
it
was
has
not,
just started. So
it just started. So I don't feel, and I myself, I'm not feeling that, that, oh, I need to take a break. I'm
and the
still
topic was
energetic.
also interesting. So
Yeah. Pelvic floors are always work. And it's very, people actually miss this out. It's very important part, pelvic floor muscles are very important part. The problem comes when people have actually going through something or the other, of their pelvic floor issues. And I've seen it this a lot since last 23 years. Okay, here it is. I got my hip, and even hip is very interesting topic. It's the way this anatomy is connected. No, once you start going deeper, my friends, you will love anatomy. Let me tell you that you will love anatomy. And you will think about, wow, so wonderfully our body is made. Yeah, so wonderfully it is made. Homeostasis, how it is working, lots of things. Okay, here we are, and we are going through hip adductors. Okay, what are hip adductors? Hope you know that. Can you just show me an action? What adductors do? Hip adductors do.
Contract and bring the.
Yes, bring the legs in. That is hip adductors, right? Then what does hip abductors does? Take the legs out. Okay, abduction. So simple. Add means to plus. Abduct means to take away. Oh, the child was abducted, right? Abduction, simple. Break it. The child was abducted. Abduction. Extensor, extending. I take my leg back. My glute muscle, my hamstring muscles are my extensors. Hip flexors, those muscles that take my leg near, like I do Pavan Muktasan. What else? Hip lateral rotators. This is my position of my feet, this movement is my hip lateral rotator. Some of the muscles would help me to rotate my leg like this, right? That's the reason it is known as hip lateral rotators. Now let us go one by one. Now remember, friends, I am taking it in groups. Okay. So if it was a quad, I will say quadricep. I will not say the rectus, femoris, and all those things. But yes, later on with years of reading and stuff, you should actually know, okay, these are the 4 muscles that fall into quadricep. Okay, quad means 4, right? Okay, solution of back problem is in the hip. Okay, here is also once again, let's say hip mobility is core stability. Okay, so mobility of the hip is very important. Let's go with this. Hip adductor group, adductors. Yeah. Difficulty in holding your legs together in inversion. So when you're doing an inversion, and if your legs are just playing out, that means you need to work on adductors. There is weakness in your adductors. What else? Legs slip down in Bakasana. When you're doing a Bakasana, yeah, is the what? Is the crane pose? Is a crane pose, yeah. Namaste, Sana. Yeah, if you're doing a crane pose, then what is happening? There is no strength in your adductors because the legs are slipping. Because if you're doing a crane pose, you have to actively engage the adductors to keep it, right? You cannot just loosen it. So there is where the adductors are being used. Legs won't separate in wide angle seated forward bend. Whenever you're doing a wide angle seated forward bend, they are not separating. It might be because of the tightness. Okay, so it can be tight, it can be weak, both depending upon how you use your legs. For example, if you are seated in a chair and you always have a habit, simple, if I always have the habit to sit like this, think about it. What will happen to my adductors? It will get tight, right? If I all the time sit like this, closing my groin all the time, what is going to happen? Adductors are going to be tight. Then if I always have the habit to sit like this, wide, what is going to happen to my adductors? It is going to get weak. depending upon how you are using your body, right? Does it make sense? Yeah, right? This is what it is. We need to really understand. Need alignment in bow legs. Okay, Veram. Veram. What does that mean? When the word drum, we'll talk about it later also, but Veram means when the knees are going out, separating. Okay, that is known as Veram. Okay, now how will you remember that Veram? Last word is RUM. What is that? Rum. Rum is that alcohol, rum, remember? Right? So when people have rum, what happens to the leg? They go here, there. Yeah, the legs keep going cross here and there. So that's the reason whenever you have to remember bow legs, the anatomical term is Veram. Okay, so need alignment, we need to work on that. Let's go with this. Okay, I don't know whether, tell me, you can hear the sound? Can you hear the sound? No. Okay, just a sec. Stop
Yes, sir.
share.
My internet was very good, so I just changed.
Acha, okay, okay, I'm just sharing the sound now. Okay, and
No, I can hear you, sir. We can hear you well.
acha, okay, I didn't know. I thought
Yeah, no,
okay.
hearing you was okay. I think it was
Acha.
my connection went off and came back again.
Acha, okay, just a second. Hide floating meeting controls. No, something is wrong. Something black is there.
Yes, sir.
Just a second. Just a sec. Something is showing black. Let me check what it is showing that black. Okay, fine. And full screen. Just a sec. Usually share screen, share screen. And yep, perfect. And play. Hey, why it is coming? I don't know what is coming in center. Okay, no worries. There's something spot coming there. I don't know what it is, but let me check more. Hide floating controls. Acha, okay. Escape. Okay, now it is gone. More hide floating meeting controls. Okay, now it's gone. Here it is. I loved this video of Van Damme. So I said, why not to share and see how the adductors are actually working. It's important to read the last statement in the closed off area. That means what you see is not actually, it was, if you actually see the video of how it is made, you will think I can also do it. There are strings attached. Okay, there are strings attached at the pelvic, at the shoulder level. He is wearing a proper attire to do that. But while editing, it is cut off. You will actually not see those. Okay, you got it.
Yeah.
So the whole thing, yeah, but flexibility is there, right? The important is he has that flexibility of going so much down, So these are your adductor group of muscles. Yeah, it can be tight, it can be weak, depending upon what we need to focus on. Okay, so once again, let me come back on sharing. Mhm. Okay, here we are. Okay, and hide floating meeting controls. And here we are. Okay, let's get with this. Perfect. Hip adductors. Okay, so let's work on hip adductors. First is adductor brevis. Now, if you see, most of the muscle is used with the word adductor brevis. You will come to know it is in the adductor group. What else? Adductor longus. It's a long muscle. Adductor longus, adductor magnus. Okay. Then we have gracilis. Gracilis, if you see, it is connecting to the tibia. That means a muscle that is bypassing, remember, a muscle that is bypassing the knee joint will always help to strengthen the knee joint. Got it? Understand?
Yes, sir.
Any muscle that is starting from the pelvic and bypassing the femur and going and connecting to the T. If I see I mentioned there gracilis T, right? T means connecting to the tibia. Any muscle that will bypass your knee joint and connect with the tibia, if you start strengthening that muscle, the ligament will get a support. The medial collateral ligament will, suppose, for example, a person has a knee issue in the medial collateral ligament, right? But if you start strengthening the gracilis muscle, the T muscles, by using a block or a ball in between the leg, like doing a semi-supine position and pressing that ball, you are actually working on the gracilis muscle, and directly you would be working on supporting the medial collateral ligament of the knee. We will talk about it later. We have the knee. Okay. What else? Pectinis. So these are the hip muscles, adductor muscle. Now, friends, I don't want to remember the adductus, longus, magnus, gracilis, pectinis, but I only want to remember that when you start working on the gracilis, that means you're not working on the gracilis, but you're working on the whole adductor group. Whenever you start strengthening the adductor group of muscle, because gracilis is one of those muscles that is bypassing the knee joint, it will help you in better knee stability, right? That's the reason you need to work on the adductor group of muscle. Let's go with that one by one. Where it is connecting to the pelvic. All the muscles are connecting to the pelvic. So that's your origin. Okay. And insertion is at the femur. Okay. It is inside. Its insertion is at the femur joint. Okay. What it is doing, it is the primary work is adduction, but it also assists in what? Flexion as well as extension. How will it happen? If some of the muscles are connecting anteriorly of the femur, it will help in flexion. If some of the muscles are connecting posteriorly of the femur, it will help in extension. Got it? Got
Yes,
it?
sir.
But it will not be a prime mover. It will not be a prime mover, because prime mover we have quads and hamstrings to work on. They will be just assisting. They will be just supporting that movement. Got it? So perfect. The prime mover is to adduct. The prime mover is to adduct. What else stabilizes the pelvic? Once again, if you have a tilted pelvic, then this is an important muscle to work on. Tight and weak. Okay, if both is possible, as I told you, depending upon how you sit throughout the whole day. What is the way you sit? Like in India, if you see, people are so habitual to sit in a cross-leg position. What happens to the inner adductor muscles? They get stretched and weak, right? If you think about it, every time you sit in a cross-leg position, if you're sitting in what is happening to the adductors? It's going wider, right? The legs are going like this. What is happening in the inner thigh? And those people who have a habit of sitting in the cross leg, what will happen to those muscles? They will get tight. Does it make sense?
Yes, sir.
Does it make sense? Now, like suppose mostly it's female. If they're having, if a receptionist is always wearing a frock, a frock, right? And to make her comfortable, she'll always cross her leg to the one side, to the other side. It is not only squeezing the adductors, my friend. It's also squeezing the pelvic floor muscles. It's also squeezing the pelvic floor muscles, right? So you need to just be aware of that. Now, what is happening? If the leg internally rotates, we have valgum. That means knock knee. Now, there are many people you'll find the knees are coming closer. When they run, their knee is in and the foot is out. You got it? They are into knock knees. Now, those people who would have knock knee, you can work on stretching the adductors. You got it? Why? What's happening? The adductors, because of the knock knee, what has happened to the adductors? The adductors have gone tight, right? Now, can I do some stretches and ask that person that, okay, by doing these stretches, how do you feel with the knock knee? Is the pain reduced? Do you have any pain in the knee? Try working on. It's always, my friends, permutation and combination. You know, okay, knock knee. Let's try stretching the adductors and see how do you feel. What else is going to happen if a person is having a knock knee? Overpronation of the flat foot. That means the foot would go in, right? Got it? Think, visualize it. If both the knees are coming closer, what will happen to the foot? The foot will cave in like this, right? It will go medially in, right? So overpronation of the foot. Cause of back pain and pelvic floor dysfunction. Remember, we went to that adductors, we talked about it. If your knees are coming or caving in, or if you have a back pain, now remember, dominoes effect. Two things can happen. The back pain can cause a knock knee, or the knock knee can cause a back pain. You got it? Understand both the things. Or if it is weak, you can also have pelvic floor dysfunction. Pelvic floor dysfunction. It can be tight, it can be weak, anything, but it can have a pelvic floor dysfunction. As you know, the tight will stop a movement happening, and weak will not control anything. It will let it fall, all the things, urinary, fecal. So we need to have a toned pelvic floor, right?
Yes.
If you see here, the knee joint, okay, posterior cruciate, anterior cruciate, and ACL, and your PCL, posterior cruciate ligament, all the things will be in a much better shape when you're doing it, right? Let's going a little bit more further here. Non-contact ACL tear. What is contact ACL tear means? I fall. I fall is a contact anterior cruciate ligament tear. But a non-contact cruciate tear is all the time when the knee is caving in. When the knee is caving in, there is a lot of pressure on the anterior cruciate ligament, and that can also lead to knee pain. But we start working on correcting the alignment of adductors, correcting the alignment of the femur, the knee joint, and the ankle joint. You might get a good result of reduction in knee pain, reduction in pelvic floor issues, reduction in back pain, reduction in back pain. Got it? Varum and valgum, stretch or strengthen. Now here it is. Now I told you what is varum. Varum is the knee going out. Okay. Varum is the knee going out. What is valgum? Last word is G-U-M, gum. Okay. What does gum means? Exactly, right. So whenever you have an issue, I cannot understand, always think varum. A person drinks, the leg goes anywhere out, right? And well, gum is when both the legs are straight. So it's easier. Now remember, if a person is a varum, that means the knees are going out. Then we need to strengthen those muscles, right? By putting a ball, some cushioning, and a fitness circle ring, and you're trying to squeeze your leg in between the ball, you will work on the adductor group of muscles. Now, imagine if someone is having a valgum. That means the knees are sticky. It is coming together, knock knee. Then what we need to do? We need to do something that can stretch that leg out. Got it? Both the things. Now, yeah, so it's very important to know when to stretch, when to strengthen. Because if you don't know that, and you're trying to work on, you might increase someone's back pain. And you will say, oh my God, I never did anything with the back muscles. How is the back pain increase? The question comes into your mind. My friends, think about what you did with the adductors. The adductor can increase your back pain, decrease your back pain, depending. Yeah. Sometimes it happens. The student comes at you, say, you know what? Okay, 5:45. Although I don't feel like taking a break, but yeah. What do you say, friend?
We'll take a break.
Okay, chalo, let's take a break of 5 minutes, 5:45, and we'll be back. Okay, come on, let's do that. Chalo, okay. Let's not stop the function, but regular, break movement here. Come, let's take a break here. And I'll mute you. Stop share. Namaste. Namaste, John, Cherry, Deepak, Sana, and Mona. Okay.
Yes, sir.
Perfect. Where is everyone? Mic check. Hello.
आस्ते 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 आ जाइए.
Yes, Cherry. Thank you. John, Mona, Sana, are you there? Okay, good. That's nice. Thank you. Where is John? Where is Sana? Okay, so it's already 52. 2 minutes more. Okay, so let us start. Okay, so let me share. It will roughly take 2 sessions to finish the hip adductor, I mean, the hip group muscle, you know. Height floating meetings. Oh, good. John is there. Okay. Okay. I'll be back. Okay, so we went through all these things. Adductor, Magnus, and everything. I think we finished there. We went through pectinis and we talked about the pelvic and the femur. Yeah. Tight week. I went through this. We talked about this. ACL and PCL, anterior cruciate ligament, non-contact ACL tear. Check asanas. Yes, here it is. Check asanas, Virabhadrasana 1, 2, and 3 in relation to your ankle. So what happens normally when people do Virabhadrasana 1, their knee starts caving in, right? If you ever see people doing Virabhadrasana 1, the front foot, if the adductors are tight, you will always find the knee caving in. And if they are weak, they will find the possibility of knee moving out. Okay. Or whenever you ask for doing any standing balancing poses, okay, in relation to the ankle, you always see the knee in relation to the ankle. So either the knee will be pointing more towards the big toe that is tight, or the knee would be pointing more towards the second and third toe, more towards the third or fourth toe, not the second toe. Second toe is most probably a proper alignment, but normally it will go to the third, fourth, or fifth, or not fifth, but fourth toe. Either it is weak or either it is tight. That means they need to work on the adductor muscles. Check if flat foot. It also happens that if the knee is caving in, it can be because of the flat foot that the knee is caving in, not because of the adductors. Yeah, so we need to check that out. Knee pain in runners are very common, okay, but working on adductors will help. Okay. Now, this is your hip adductor group of muscle. We talked about it. Let's go a little bit more further. This is the way you'll be working on pectinis, brevis, longus, magnus, gracilis, aggressive into the tibia. Okay. So we have a sumo squat. We have a sumo squat. We call that what? The goddess pose. The goddess pose. Normally in the goddess pose, what people do, they hold the position. I would recommend move dynamically. Got it? Move. You know what is goddess pose? Arms to the sides, right? Here they are holding statically. You move dynamic. In yoga, we actually hold isometrically, right? Here you can add a dynamic movement by keeping the arms like this, and you can also add this movement. So what you do, you work on the rhomboids, you work on the traps, right? So you can actually add that. Okay. Now this is why this is come. Any guess? I cannot hear you, Mona. Why it is there? Any guess? Why peanut butter comes here?
Yeah, maybe for joints, no, some kind of oiling, something related to that. Because of the
John,
reading,
guess. Why it
okay.
is showing me peanut butter leaves me greasy? Nice one, Mona. I liked it. Any guesses? Why I have given this image peanut butter? Peanut butter leaves me greasy. Come on. The answer is there. Yes, Sana, you need to add something. Why it is that I have mentioned peanut butter leaves me greasy? I mean, so what it is? Am I going to apply that peanut butter on my adductors or my knee joint? Okay, should I?
Okay.
Ding dong.
Yes, please.
Okay, you see here, hip adductors are which muscle? Pectinis, brevis, longus, magnus, gracilis. So peanut butter leaves me greasy. The mnemonics to remember these 4 to 5 muscles. You got it? At least 5 muscles. Peanut butter leaves me greasy. So when students, when students go through examination, there are special ways to remember these things. Like how you remember, I told you about the breakfast, lunch, dinner. Remember that how you remember. In the same way, these are mnemonics to remember. Peanut butter leaves me greasy. So you can say, oh, pectinis, brevis, longus, magnus, gracilis. You got it. But I liked it to apply it on the knee. Okay,
So
that's
this is
good
the
one.
second one. First one you gave it to us for a vertebrae, I guess. C1, C2
Yeah,
vertebrae.
exactly. Yeah.
And this is the next
Okay.
one.
Okay, just to remember, see, although you as yoga teachers, we don't want to go so much depth into remembering each and every muscle, but it is good whenever tomorrow you want to have an idea. Okay, peanut butter makes me greasy. You can say, okay, P's, pectinus, B's, brevis. Sometimes if you just remember the name, peanut butter makes me greasy, and you might sit somewhere and you start thinking, okay, what is those adductors? Let me think. What will happen is, if you remember just 2-3 times, my friends, it is there in your mind, right? But remember, you don't need to, but as I told you, when you start reading anatomy books, mostly people will use the word hip adductors. But because gracilis is a muscle that is bypassing the knee joint, you should remember the word tibia. Okay. So what else? Strength, supine side lying series. Okay. So when I'm lying down on the sides and I'm lifting my leg up on the sides, right? Remember, think I'm lying down on the sides. Now lifting my leg up. These are all like while on the sides, rotating the leg, taking the leg up and down on the sides will help to work on that. Single left leg, circles, abduction, adduction, or these are some of the movements. Okay, what else? Both leg lift up on the sides. Any asymmetrical standing, Virabhadrasana 1, 2, 3, Vrikshasana. Okay, or when you do lift the leg up and down, plantar flexion and coming forward, you're working on it. Isometric adduction, Setu Bandhasan with a block or a ball, small ball. Tabletop hip adductors. What are those? I'm in a tabletop position. I take the leg out, take the leg in. Or I even supine position, straighten the leg, supine position. I take the leg out, I take the leg in. If I want to work more, I will use a TheraBand, the bind TheraBand, hold it there, and I'll take the leg out and in. You got it? So these are some of the ways you can strengthen and stretch those muscles. So when you're doing the movement, you're actually working on both. You're strengthening one way, you're contracting the other way, right? And these are some of the ways to actually stretch. Stretching, supine, supta, baddha konasana, upavista konasana with the wall. So I lie down and put my leg on the wall and I can do that. Okay. A padmasana, vrikshasana. Why? Because one leg is going out. Okay. Malasana, right? Prone, mandukasana. Okay. Mandukasana. But just be careful in mandukasana. There's a lot of pressure on the knee joint. Okay. So just need to be careful. A standing prasarita paduttasana. Standing wide leg forward bend will also stretch your inner thighs. Okay. So in your practices, you need to see that am I adding some strengthening and stretching of adductor. So we definitely need strengthening and we need stretching both. So in your sequences, try to think of adding these. Okay. Now here it is. What is the misconception? It's best to keep the feet together in Tadasana. This is all we have always, have you heard this very standard cueing that everyone says, oh, feet together, feet together, feet together. Okay. But if you see, as I told you earlier also, I don't remember, but normally how your frame is, how your pelvic is, according to that, you are free to keep both feet together or hip width apart. Suppose someone is an XXL size where the hips are wider, the frame is bigger. For them, if they keep the feet together, first of all, their thighs would not allow. Their big thighs will not allow. And when they keep both the feet together, they will not have a foundation, right? And that's the reason it is always good to separate the legs wide apart. You'll always see yoga teacher, put the feet together, feet together. Why? Because they were never taught anatomy saying we have different frame. We have ectomorph, we have an endomorph, and we have a mesomorph. Right? Now remember, during those times of Pattibi Joyce, I told you earlier, when he was teaching in the Mysore Palace, most of the students were young. Okay, they were thin framed. And that was the reason keeping both the feet together in attention was compulsory, right? But nowadays we have different type of frame of people. We cannot have both. So classical era and modern teaching now are slowly and steadily differing. Like classical era says, take the head back in Bhujangasana, but the modern era says, try to keep the cervical neutral. Don't compress, right? This slowly and steadily things are changing. Women hips are wider. Okay. For many people, standing with the feet at hip distance is more stable. For many people, standing with the feet at a hip distance is more stable, decreases the Q angle, and reduces stress on the knee, right? Otherwise, what will happen? The knee will knock knee and the hips are wide. Think about what is happening to the first image of a female. The knee, the hips are wide, but what is happening because both feet together, knee is going in, and then the feet is slightly going out, right? Actually, you are creating more problem. Instead of that, I would have said that, okay, hip width apart, how you feel. And the best thing, my friend, is as you're teaching yoga to groups, ask them to put feet together, everyone. How do you feel? Put hip width apart. See how do you feel? You will get a lot of information from the student itself, and that is the time you learn, right? For rest, not a stable and a tense adductors, right? For the rest, when they take it together, yeah. Hip over the knee, over the ankle. So the best alignment cue is hip joint, knee joint, and ankle joint in one straight line. Yeah, if you ever see the alignment of joints, it's always the hip, knee, and the ankle in one line, much safer. Than load is equally distributed. But if something happens with the hip wider, it's not a line posture. Restore the balance between inner and outer thighs. See what is happening. If I am having a knock knee, definitely my AD ductors will get tight, but my AB ductors will get weak, right? Think about it. But now, if I align my legs, my AD ductors, my AB ductors, both would be equally in tension, equally involved, right? And that's the reason a hip width apart is much more desirable than feet together. Does it make sense? Yeah,
Yes,
think
sir.
about it logically. Yeah, think about it logically. It does make sense because otherwise we are always taught. Even I was taught in my classical feet together, feet together. And we used to do blindly because yoga is cure for all the problems, you know. So we used to just follow everything, but not really now. When you start reading books, you'll realize actually nowadays yoga is creating more problem. Right? Yeah. First of all, the problem that, oh, I am a yoga teacher. I should have my own space. Oh, the kids are disturbing me. Oh, that's not right. Hope I was a yogi. You always that comes into your mind, you know, and that always happens that when you want to do your yoga practice, your kids might disturb, your husband might disturb, and then you feel, oh my God, it's like so much disturbance here. You're creating more problems just because you're a yoga teacher, right? And we want that space for our own self. Yeah. We have to accept some things like we are part of everything. Avoid together if valgum. Okay. So if the knees are together, definitely not. Avoid that out. Okay. Now we go with the next muscle is your hip abductor. Definitely now we're talking about the outer thigh muscle. Okay. Now let's go with this. Okay. Oops. Okay. Just a sec. It all came in together. Okay. I think that's fine. Okay. Play. Okay, let's go one by one. Where the abductor, oh, there's one small line. Is it disturbing the small? Is it the small line disturbing?
It's okay, sir.
Okay,
It's okay.
fine. Okay, good. Okay, so now what is, where does the abductor muscles are used in our day-to-day life? When we step aside, if you're in the car, think about you sitting in the car. You have to first take your one leg out, right? Think about it. When you take that one leg out, what is the muscle working? Your abductors are working, right? Think about it. You're sitting in the car, you put one leg out, then so one leg, abductors are working, other leg, adductors are working. Got some idea?
Yes, sir.
Right? Both the legs, both the muscles are working. If I take my left leg out, first my abductor would work. Then when I take my right leg out, my adductors would work, right?
Yes,
You're
sir.
getting out of the bed, okay, getting out of the car, strength, valgum or valgum. So what does that mean? If I am having knock knee, okay, I am having knock knee, there are two things I need to do. What that means? First, I need to stretch my adductors and strengthen my abductors. You got it? Think about it. Think about it. If I'm having a knock knee, the knees are coming closer. And you will find many women when they walk, they will always walk with the knee a little bit more inner. You see that, if you ever go in a jogging park, people. So the next thing is tomorrow or day after, when you get time, go into the park and see how people are walking. Or you also walk, but look people behind, how their knees are moving, how their pelvic is moving. Okay. And just be careful. It's not good. But still, if you want to learn, you have to be. I'll tell you. See, I never did it purposely, but what happened is, like I saw this person, this female buying, and she's like, why the knees are going so closer and the foot? Then I started seeing her sole, the shoe, and even the shoe was deteriorated. It was going in just because she was walking. And she was walking briskly and fast, no problem. But the knees were slightly caving in. Might be after 5-10 years down the line, the MCL and the ACL, anterior cruciate ligament, and the medial cruciate ligament might have a constant pressure, and that can give load to her knee joint. Got it? That's the reason how people walk, how people come to your class. You will get an idea whether they are knock knee or bow legs. Or sometimes watching at the sole of their shoe. The sole of their shoe. Remember, what will happen to knock knee people when the feet is caving in? One side of the sole would be more used compared to the other side. Got it? This is the way you look at it. If you want to make sure whether she is a knock knee or a bow legs, just watch the sole of the shoe. You will get a rough idea of what it is. Yeah. And the best thing is observe people walking. Observe people, but definitely with understanding. Okay, you can't just keep oogling and walking straight in front. You can't do that, right? You have to have a little bit of sense that okay, I can see that. Yeah, it's like you have see, you don't have to offend someone at the same time. Yeah, and especially if you have your better half with you, never do it. Or I mean, it's like for males, you have to be very careful because I have faced the brunt. So, just it's like how much you make them understand it's difficult. It's like always like, you are a culprit. You are a culprit. Anyhow, coming back. Okay, so what are the cause? Sitting. Okay, once again, excessive sitting. Avoid prolonged stretching. Yeah, people sometimes have a habit to all the time sit in a malasan position or the legs wide position. Okay, standing on one hip, right? If you see, when people stand, what happens? They will not stand straight with both feet. Okay. So what they will do is, stylish. It's like, it's like this. Okay. Or it will be like this. So what is happening? You got it? One leg is taking a load a lot, then the other leg. I can just lift that one leg up. It is so much loaded on the other side. It's a style. Like people like, this is style or taking a photograph. People don't want to take a photograph like this. It's like, wow, it's so weird. But yes, putting the leg on one side and standing, oh, that's look cool, right? But actually, if we have that constant habit pattern, it's not good. Okay, cross-leg position. Yeah, if you're sitting in a cross-leg position or seated cross-leg position, as I told you, the abductors will get tight and the adductors will get weak. Okay. One side sleeping with top knee flexed and the knee touching the bed. Important. When you're sleeping on the side, hand like this, but the top knee, the leg that is on the top is bent and the leg is more forward, right? That can also cause a problem. Okay. So one side sleeping with top knee flexed and knee touching the bed. Think about it. What is happening? Your pelvic is already tilted in sleep. Your top pelvic is gone forward and the knee is going more forward, right? So one side of the muscle is being stretched more when you're sleeping on the sides, okay? Knee health and stability. So once again, these muscles would help you to stabilize the knee joint. We will come there later too, okay? So weak knee caves in, you will have a flat foot. What will happen if my adductors are tight and my abductors are weak? Definitely there is a possibility of flat foot, right? There is a possibility of flat foot, okay? Plantar fasciitis. Plantar fascia, we have a muscle, we'll talk about it when we go with the ankle joint, okay? Tight or weak, depends, friends, okay? Depends. So we cannot have a firm conclusion that every time abductor muscle should be strengthened or stretched, depending, okay? Depending upon what problem the person is going through. According to that, I will work whether I need to do foam rolling, if it is tight, the TFL area, or do I need to really strengthen those? This is a call that you have to take as yoga teachers, what things I need to do. And after doing today adductor strengthening or stretching, how was the student feeling? Was the pain increased in the knee? Has the pain reduced in the knee? Why? Because some of the muscle would definitely bypass the knee joint, right? So let's get a little bit more further to understand. Hip abductors. Yes, Mona.
One side sleeping, you said. So if we can change the side, first time at the, firstly on the right side, and then we can change the side and do.
Yes, definitely. Then there is no issues. Then definitely.
Then there is no.
Even I also sleep on the. Yeah, it's always a balancing, Mona. It's always a balancing. In fact, even for me, I have tried that. I have read a book. They say sleeping in the supine position is very good, and I tried for months and months and months. I couldn't sleep. I don't know. The sleeping on the side is so habitual that I get sleep. But I tried sleeping in Shavasana, saying, "Okay, I should get a sleep." I don't get a sleep at all. It's like I'm still closing my eyes and thinking, "Let me sleep. Let me sleep." No, I'm not getting a sleep. Got it. So I do also sleep on the sides, but I make it a habit. The left side first. Okay, then the right side. Okay, then it keeps stopping. But that's fine. I never had any issue as such. But I don't know. Or might be I sometimes sleep on the abdominal positions where, this is the way I normally sleep. But in the supine position, I find it really difficult, very difficult. Okay, so it's good. No worries. Yeah, because we have been doing it for years and we are now experienced. Okay. So let's work on the hip abductors and let's see what are the muscles of hip abductors. Gluteus medius, the glute muscle. Okay. So remember, the glute muscle also helps you in extension of the hip joint. Okay. Gluteus medius. What else? Gluteus minimus. 3 muscles are there in the glutes. And your sartorius. Let's work it one by one. What else? TFL, tensor fascial artery. Now, TFL is always a painful muscle, always a painful muscle, especially with athletes when they start doing it. It's a lot of tightening in the TFL. Okay. And gluteus maximus as a synergist. Okay. Gluteus maximus as a synergist. It's a supporter. Because the main work of the maximus means big size, big chunk of the buttock. What is doing? It is extending your leg. It's taking the leg behind, right? So gluteus maximus primary work is extension, but here it's working as a synergist. While your gluteus medius and minimus prime work is abduction. Okay, let's go with that. Okay, here it is. Let's understand the origin of the glute medius first, the small one. Origin is at the posterior ilium. Okay, that means at the pelvic between the superior and the medial gluteal line. Okay, that means connecting to the pelvic. And origin is there, and insertion is the greater trochanter, and it's on the side. Okay, greater trochanter is on the side. So whenever the origin pulls the insertion, the leg will go out. Okay, what else? Let's talk about the glute minimus, or outer surface of the ilium. Same thing. Okay, between the inferior and anterior gluteal line. Insertion is the greater trochanter, and in the femur we have a protuberance. It's like a little bit lump bone where it's connecting, that is known as your greater trochanter. When we were covering femur, I talked about the greater trochanter. Okay, so origin is basically where? At the pelvis. Insertion is where? At the greater trochanter. In both the cases, if you see, insertion is where? At the greater trochanter. That means whenever the origin will pull the insertion, what is going to happen? The leg will abduct. Okay. Now what is happening here? What is the work? Primary is abduction and internal rotation. Okay. While the gluteus medius, what it is doing, it will slightly extend also. Okay. So hip abductors, gluteus medius and minimus, TFL, sartorius, synergist, and glute maximus. What it is doing, it is stabilizing your pelvic. Like the way the adductor were stabilizing the pelvic, even the abductors are stabilizing the pelvic. That means if there is some alignment issue with your pelvic, you need to check, are the adductors toned enough? Are the abductors toned enough? Those are very important to manage the pelvic stability. Okay. Gluteus medius and minimus are lateral stabilizers of the hip. Hold the pelvic stable on one foot. Remember, any asana that you're doing, like Vrikshasana, you're doing on one foot, like warrior 3, you're doing on one foot. Whenever you do that, the gluteus medius, minimus will actually work to stabilize the pelvic. So when you start doing a standing balancing poses, you start working on the gluteus medius, minimus to strengthen, to balance the pelvic. Okay, and so that's the reason, once again, definitely add balancing poses. Apart from co-contracting your quads and the hamstrings, it is also working on the glute muscles. Okay, weak seated, glute turns off and TFL turns on. Very important point. What is going to happen is, whenever I'm in a seated position, what will happen to my buttocks is, every time I'm sitting for 7 to 8 hours, my glutes are getting off, they're getting weak. So when I'm walking, what is going to happen? The glutes will turn off and the TFL, the tensor fasciae latae, will turn on. That means the side of the muscles, we'll talk about that muscle later, but the TFL will turn on and that will be more tighter. Actually, the work that should be done by the glute is now done by the TFL. Why? Because of every time seated, you have made the glute muscle off. And to compensate that, the side of the muscle, the TFL, starts getting active and they start doing more work, right? And that is the reason you will always have a pain in the side muscles. That is your TFL. Okay. Adding knee varum or valgum. So strengthen glute first and TFL will be off. Okay. So whenever you are thinking of working on, try to strengthen the glute group of muscles, automatically you will find that your TFL work will be off. Whenever the TFL is on, the glute is weak. But whenever the glute is active and worked, your TFL will be off. Normally, runners, if they don't focus on the glute muscle, they actually activate more of the TFL. They overwork their TFL, and that's the reason most of the time they find intense pain when they're doing foam rollers. Intense pain. And that's the reason it is very important to work on the glute. Means you should not neglect the glute muscle. You should not neglect the glute muscle. Okay, very, very important. Very, very important. Okay, let's go with it one by one. Tensor fasciae latae. Okay, now let's talk about the origin. Origin is where? ASIS, anterior superior iliac spine. Okay, now if you see here, TFL shows muscle, and then there's a white area coming, it's the white area going in. That is your band, that is your ilia. It's like a tendon going down. Okay, it's the tendon going down, and where it is connecting to, if you see, it is connecting to the iliotibial. That means it is bypassing the knee joint and connecting it to the tibia, right? So it's passing the knee joint. So what it is doing here, let's see. It is assisting glute medius and minimus. So that means it is a supporter. It's supporting the gluteus medius and minimus to abduct the leg. Okay. And what else? Medial rotation. What it is doing, it is also slight flexor. That means helps to flex, as well as a pelvic stabilizer also. So all we talked about till now, the adductors were pelvic stabilizers. The abductor is also a pelvic stabilizer. Tight or short? Now, as I told you, because the glutes are off, this muscle would be always tight. And you will always see athletes, they will always enjoy working, giving a fascia release to the TFL. They find an intense pain, but they love it, right? The TFL, tensor fascial latae. So pelvic lateral tilts, pain in hip, lower back, and lateral area of the knee, right? Because it is bypassing. If this becomes tight, it can give you. So there are times when you have done a myofascia release of the tensor fascia latae, and you will find that the knee pain has reduced by 10 to 15%. If your TFL is tight, if you're into any sports of fast activity. What else? We talked about it. Due to underactive glutes, TFL is overactive and tight. That is mostly happening. Very standard with marathon runners. Okay, marathon runners. Now, this is also very important muscle. I definitely want you to remember TFL, glute medius and minimus, and even the sartorius. Okay. Now let's understand this sartorius connection. Origin is ASIS. Now, if you see how it is moving, it is going from the top, circling like an S, and where it is connecting to the pes anserine, basically at the tibia. Okay, at the tibia. Let's go with a little bit more further to understand. Now see how much movements it is doing. It is a hip flexor. Why? Because starting from the ASIS, it is a hip abductor. It is a lateral rotator. And it's also a knee flexor. Why? Because it has bypassed the knee joint also, right? So it becomes your knee flexor also. So remember, a single muscle, if it passes two more joints, more movement, one joint, less movement. If you see sartorius, sartorius is a two joint muscle. That means it is bypassing the hip joint and it is bypassing the knee joint. That's a long line muscle. Okay. It is also known as a honeymoon muscle, because that is or whenever you are basically sitting in a Padmasana, whenever you are seated, semi-supine position, and when you open the legs wide up, the sartorius muscle actually gives that work, because what you're doing an abduction. Okay, that's the reason known as honeymoon muscle. Longest muscle in the human body. Yeah, we have largest, we have longest. So this is and we have the thinnest muscle. So this is the longest muscle in the human body, because by starting from pelvic and crossing and turning around, it's turning around and going towards the tibia. What else? Tight, short. That means it is overused. How the TFL was overused, even the sartorius is overused. A sartorius is also known as a tailor muscle, or the cobbler muscle also. Why? Because when the cobbler sits, he holds the shoe in between his feet. But what is the knee? The knee is played out. Okay, so that's the reason it's also known as a cobbler. Right? Now, culprit. Anything seated with legs wide can be a culprit. Okay, so you need to be very careful. And in India, if you see a very logical reasoning, most of the females, I'm talking about the grandmothers and in the olden era, they always had a habit of sitting in a cross-leg position on the floor, always. But when you see at the age of 60, 65, 70, most of the senior citizens start having a knee pain. Have you seen that? In India, mostly happens because those people who are habitual of sitting in the floor all the time will always find the knees are playing out, the sartorius, the inner thigh muscles, all is being weak. And that's the reason the pain comes on the knee, right? So once again, because sartorius is bypassing the knee joint, we definitely need to strengthen the abductors. Is it clear? Got it?
Yes, sir.
Because even the TFL was bypassing the knee joint, and now the sartorius is also bypassing the knee joint. That's the reason it becomes very important to strengthen your abductors. Okay, cause of knee pain too. I told you, right? The cause of knee pain. Now we know why it is the cause. Why? Because two muscles are bypassing. The glute minimus and medius is not bypassing, because it is connecting just directly at where? The greater trochanter. But what is happening? These two muscles, they have a long length. The sartorius as the TFL, both are bypassing two joints, right? And that's the reason it can be a cause of knee pain. Now, this is an example of the students coming to our teacher training course in Goa, Dharamshala, and not even in Bali also. Yeah. So what, and this we see a lot. First of all, we see a Bali belly. Okay. Bali belly is the food that you take and they have an upset stomach. We call it a Bali belly. And the other is when foreigners come to India, the spice and masala, they also have a problem over there also. It's like a lot of digestive issues for the first 3-4 days, nothing else. In the same way, those people who have never sat on the floor in the cross-leg position, they have been always seated in the chair for years and years. And now they're coming to India. They are going for a teacher's training course for 200 hours. And they are taught, they're not taught, but they don't have any other option. They are sitting on the floor thinking that, oh, being on the ground feels so nice. I'm grounded, the earth energy and everything. But after 3-4 days, they start having a knee pain. You heard it? Oh, my knees are paining. Oh, my buttocks are paining. Why? Because they never had the habit to sit on the floor in a cross-leg position. And they also start having a back pain too. Got it? Why? Because they start tilting posteriorly, right? Those who have never sat in a cross-leg position, and when they start in one flow, this is not like progressive also. Like for hours and hours, for the sessions, they are sitting in a cross-leg position. They are definitely going to have two things: back pain and knee pain. Very standard in teachers training course. Yeah. Does it make sense? Are you getting it? What I'm trying to explain the logic. You're getting it, John? Yeah. Now stretch.
So,
Sir, I
All
think-
the,
can I ask a question? So what is the best, I mean, what's the middle point here between, you know, sitting,
Okay,
sitting
okay.
in lotus position or not sitting in a lotus position?
okay, I'll tell you, Sana, here. The best thing is, Sana, whenever you are, if a beginner person is sitting for the first time, Sana, try to use cushions or bolsters so that the thigh, instead of pushing down wide on the floor completely, when you put some cushion below the knee, below the thighs, the stretch would be not so much on the ligament of the knee as well as the adductor muscles. You can keep two bolsters, sit on it, and sit on a bolster or a block. So your pelvic would be higher, right? So you're not into posterior. In fact, you would be neutral, because whenever you sit on a floor in a cross-leg position, it's very easy for the pelvic to go posterior. So first, sit on a block. Got it? For back. Second, if you are sitting in a cross-leg position, add 1 or 2 bolsters. Got it? And sit, no problem. And then sit, stand, chair. Sit, stand, chair. Keep moving around. And as and when you are progressing slowly and steadily ahead, you can then sit. Like for us, we are sitting for my dinner, I sit on the floor like this only. And since childhood, I thought when I will get money, I will buy a dining table, but it never happened because I still enjoy sitting on the floor. You know, it was like, oh, people, you know, people in flats are having a dining table and a chair. When I will get rich, I will buy one. But it never happened because I still enjoy eating in a cross-leg position on the floor and clearly on the floor. And I still enjoy. And I still use hands. But if I go to some places where they're using spoon, I find it discomfort. But just to maintain an etiquette, I make the spoon and fork as a habit. Otherwise, I still enjoy eating with hands. Even at home, you will not find in my hall any dining table or chair. We sit, everyone, all except my mom sits on the chair because she has an issue. Otherwise, everyone sits on the floor, eat, and there's a wiping of the floor. As simple as that. And since years we are doing that. Yeah, since we have so much habitual. So for us, it is not a knee pain. Yeah. Yes, Deepak.
When I go to a restaurant also, I sit cross-legged, sir. On the chair, I cross.
I used to do that, Deepak. But what happens is, you know, in some of the restaurant, it's like, oh my God, he doesn't have etiquette to sit how he's sitting. You know, sometimes, you know, it's just that thing of, I don't want to. I agree with you. So at places where I feel that I'm very comfortable and people understand, I don't mind sitting in a cross-leg position, because some places we need to have just maintain that, you know, the decorum of that place, you know, it's something. So I just say, okay, You have to, be. Otherwise, normally I would love to sit anywhere. Even what you're saying, I would love to do that. But some of my students themselves, so it's not good. Although you're a yoga teacher, but some don't show your yoga teacher everywhere. So I said, okay, I will listen to my students. So it's just Deepak is like understanding. It's not nothing wrong in it. You can definitely do it. Okay. Anyhow, you got it, Sana? Is that clear? Yeah. Perfect. Okay. Now these are the different ways, my friend, to stretch the glute muscle.
We don't
Okay.
have time, sir. We don't have time.
Oh yes. Okay. Good. 6:31 already. Okay. So stretch and everything, we will take it later on. We have a stretch, and then we have all these things are myofascia release. Okay. Perfect. We will take it the next time. Okay. We have what? We have extensor group, and then we have perfect. We'll finish it tomorrow easily. Yeah. Okay, up till now, is it all getting in? Is it?
Little by
Yeah, little bit. Yeah. At least some concepts are getting clear. Remember, I always say, even if 50% you understand, my friend, it's good for me. Why? Because the 50% will come when you start reading the books that I will share with you. Yeah. So,
Yes,
and I will also share you which books to read first, as I told you. Yeah. So, any questions up till now? All going good?
Good, sir.
Okay, fine. Come. Perfect. Thank you, Cherry. Let us sit tall, chin tuck, lengthen from the crown of the head, and don't forget the gentle smile. Yeah. Smile at yourself and say, I'm happy. I know I'm married, but I'm still happy. I have kids, but I'm happy. Tall yourself, neck and shoulders, relax, breathe. It's only after being a yogi you realize that, oh, I did a mistake. But it's too late. Enjoy. Lengthen from the crown of the head, neck and shoulders are relaxed. Lift the shoulders up, back and down. Let's recite the Omkar. Shanti, Shanti, Shanti. Thank you, John. Thank you, Deepak. Thank you, Mona. Thank you, Cherry and Sana. Thank you. I will see you tomorrow. Take care. Keep smiling. Namaste.
Namaste.
Bye-bye. Bye.
Thank you.
Bye-bye. Take care.